Bill, how about over at Defense Healthcare? What's the future look like? I mean, what can we expect as a war fighter in 3 years, let's say?
Well, so let me take it up a notch as to what we should be striving for, right? We're a group of IT people here today, so we like to talk about IT. And I think that's powerful, and it helps us drive capability into the hands of the providers and into patient support. But what we really need to be striving for is, and there's a couple analogies I like to use, is IT you don't have to think about, right? Our providers and our patients, or the patients, they don't care about the IT. They care that things work and they get the experience they want. I use a theme park as an analogy for this sometimes to help clarify my thinking. So really, when you go to a theme park, you don't care about the power, how the power gets there, how the plumbing is done, how the roads get there. You care about the rides and the experience when you're in the park. And the IT people are keeping the park running. And from PEO DHMS perspective, we build the rides, which is a really cool thing, but that's what people go to the park for, is those healthcare capabilities that we provide. The other thing that I think is, it's also an analogy, I'm sorry for that, but I read something last summer, not this summer, about the guy that invented air conditioning, right? His name was Willis Carrier. I think I read it in the Post in July. And it was an interesting story because he was a printer. And he had a problem with his print plant, and he couldn't get the ink to stick to the paper because of the humidity. So he tried to figure out a way to get the humidity out of the print plant so that his print plant would work. And so he did that. He invented air conditioning to do that. He had no idea. He knew why he did it. He had no idea the impact it was going to have on the world, how we work, and frankly, even on healthcare. He knew why he did it. He didn't know where it was going to take us. We talked today a lot about what we're doing and why we're doing it. I think we're in a place now where we're doing the right things, but we're doing things that are so powerful we can't even comprehend where they're going to take us. Much like air conditioning, it did a whole lot more than allow a print plant to operate effectively.